Hello everyone and welcome again. So continuing our discussion about the clinical pharmacology basic principles class. Now we are going to talk about the pharmacodynamics, the agonist dose response curves. Now we remember that in the beginning of this class we talked about the concentration time curves, and those were in the pharmacokinetics. So concentration time curves are in the pharmacokinetics, and that's because, remember, the pharmacokinetics means what the body does to the drug, and the body tries to eliminate the drug, and that's why we do concentration time, because with the time going, the concentration will decrease because the body is eliminating the drug. Now, in the pharmacodynamics, we dealing with the dose response. So dose response curves, those in the pharmacodynamics. Remember that in the pharmacodynamics deals with what the drug does to the body, and the drug do response to the body, do action, and that's why we make it into dose response, because with the dose there would be an action or response in the body. We also can call it the concentration response in comparison with the concentration time in the pharmacokinetics. So in this video, we will first define the agonist and the antagonist, and we will explain the dose response curves on the mainly in this video on the agonist, and we will talk about the quantal and graded responses. We will talk also about the efficacy and potency, and finally we will talk about the therapeutic index. So let's start. Now first let's define the agonist and antagonist. So when a drug combines with a drug target, we mentioned that drug targets are either a receptor or an ion channel or an enzyme or a carrier molecule. This may lead to one of the following. So when a drug binds with a drug target, we may get one of the following, which is either an agonist effect or an antagonist effect. Now the agonist effect is the drug binds and causes the same action as the normal substance that bind to the receptor. So we get the same action as the normal substance. In the antagonist effect, the drug binds and stops the action or effect of another substance. So the drug binds to the receptor and stops the action of the normal substance. Yeah, so we have agonist and antagonist. Now the interaction between the drug and its target can be described as by a curve, because the drug effect affects natural regulatory processes, so their effect follow a natural curve. So let's draw a dose response curve, and so we have the vertical axis and we have the horizontal axis. The horizontal is for the dose, also called concentration. The vertical axis is response. So the more dose we give, the higher the concentration we get, or the higher response we get. And the more we go right to the right, we give more dose, and the more we go up, the more response we get. So when we give zero dose, we get zero effect, which is here, and the more dose we give, the more effect, until we reach the maximum effect. So the maximum effect is here, which is 100 effect, 100% effect, and it is about this dose here. Now the response is 50, and if we plot it, we get into this dose. Now, the maximum effect is called the Emax, which is effect max or maximum effect. And we also have the dose that achieve the half effect is called the EC50, which is the concentration that achieve 50% of effect, or it's also called the ED50, which is the dose that achieve 50% of the effect. So either EC50 or ED50, and it is ready from the middle concentration that achieve 50% of the effect, dose that achieve 50% of the effect, and it is right here in this curve. So we have the Emax, which is the maximum effect, and we have the EC50, which is the concentration that achieve 50% of the effect. And this curve is called the linear curve. It is the type of linear curve. We also have the logarithmic curve, which like that. We have also dose and response, and the line would be similar to the S letter, so it will be like that. That was we call the logarithmic curve. Now we have some terms that is related to the receptor and the drug. So we have the affinity and the occupancy. The affinity is the probability of a drug occupying a certain receptor at a given concentration. The higher the affinity, the higher the binding to the receptor. While the occupancy measures the extent to which the drug is occupying the receptors. So the occupancy, the higher the occupancy, which is the higher number of receptors occupied. While the higher the affinity, the higher the drug binding to a single receptor. So again, occupancy related to the number of receptors occupied. The affinity is related to the binding between the drug and the receptor. Now let's explain the quantal and graded responses. Graded and quantal responses are associated with the agonist drugs. So we will see them only with the agonist drugs. The graded response is the same example with the first curve that we draw in the previous slide. So the response is increased proportionally to the dose. So the higher the dose, the higher the response with the graded response. Example is the response of the heart to the adrenaline. So the higher the adrenaline, the higher the heart contractility. And it is the response to most drugs. So most drugs would give us a graded type of response. And the response could be tested in one animal or one human in randomized controlled trials. So we can do it with one human on the randomized controlled trials, because the other one have to be more than one. And let's draw it again. So the first example we draw was a graded response, but we are going to draw it again here. So we have dose and we have the degree of the response. So the higher, and it is in single person, degree of response in a single person. So the higher the dose, the higher the response until we reach the max. Now for the quantal response. So the quantal response, it is an all or none response. So we either get the max response or we don't get any response. So we get a max response in a single person, or we get no response. We get no response. in comparison with the graded response. With the graded response, the higher the dose, the higher the response. While here, we either get the max response or we either get no response whatsoever. And example is the prevention of convulsions by anti-epileptic drugs. So when we give the anti-epileptic drug, we either prevent the seizure or we either don't prevent the seizure. So it's an all or none response. And it is a response to few drugs. So few drugs exert this response, and the response could not be tested in one animal and must be tested in a group of animals or humans. Example would be if we draw this curve. Here we have the number of responses. And here we have the dose. So number is 10, 20, 30, 40, 50, and so on, depending on the number. So the higher the dose, the higher the number of responses. So if we give, let's say, this dose, we get only 10 responses. So only 10 people will respond to the drug. While if we increase the dose a little bit, we get 20 people respond. If we increase it more, we get 30, and so on. So it is number of people would increase with the higher the dose. So and it is an all or none response in a single person. So we either get it or we either does not get it. Now let's talk about the efficacy versus the potency. The efficacy refers to the effect of the drug. From the name, efficacy refers to the effect of the drug. The more effect of the drug does, the higher the efficacy of the drug. The Emax, which is the effect max or the maximum effect, is maximal effect that a drug can elicit at a specific concentration. Now we have the full agonist and the partial agonist. The full agonist occupies all receptors at a certain dose, and it activates all of them, leading to maximal response. While the partial agonist occupies all of the receptors, but it doesn't activate all of them. So we get less than the maximal effect. The ED50 is the dose that achieves 50% of the effect. So dose that achieve 50% of the effect, and it is also the dose that gives 50% of the Emax in the graded response, or it is the dose that gives the desired effect in 50% of the tested population in the Quantal response. The EC50, on the other hand, is the same as the ED50. The EC50 is concentration that achieve 50% of the maximal effect. 50% of the effect. So the drug that has a smaller ED50 than another drug is described as more potent than the another drug. So the drug that has a smaller ED50 means it is the drug that achieves the 50% of the effect in a smaller dose than another drug would be more potent than the another drug. And the potency of the drug is less clinically important than the efficacy, because you can increase the dose of a less potent drug that has better effect, and we get the better effect than the potent drug with less effect. And we will explain that in the next slide, where we draw a dose response curve, and we will explain the efficacy and the potency. Now let's draw a dose response curve. So we have here the response and we have here the dose. So response on the vertical and the dose on the horizontal. And let's say we have two drugs. The first drug, it gives us response at this dose here and starts giving us response until it reaches here, which is the Emax of this drug. The other drug, on the other hand, it is a little bit, it need more dose until it start giving us effect, which is here, but it give us more effect. So it would go here and reaches into here. Let's call them, this one is drug A, and this one is drug B. Here we have the maximal, the 100% of the response, and here we have the 60%. So drug A reaches 60% of the effect, while drug A give us 60%, drug B give us 100% of the effect. Here we have the 50% of the effect, and for drug A, it is so the ED50 of the drug A is about here. So that's here, the ED50 for the A drug, and here we have the ED50 of the B drug. So this is also here, the ED50 for the drug B. Now regarding efficacy, the drug B have achieved more effect than the drug A. So a drug B here more efficacious than drug A. So drug B more efficacy compared with the drug A, while a drug A is more potent than drug B. So drug A is more potent than drug A. So that's regarding the potency. So drug A is more potent than drug B because it achieved the 50% of the effect in less dose. So the ED50 of drug A is less than the ED50 of drug B, and that's why the drug A is more potent than the drug B. Yeah, so that's pretty much the efficacy and the potency. The drug B was more efficacious, but it was less potent, while drug A was less efficacious, but more potent. Now let's talk about the therapeutic index. So the therapeutic index, it is the ratio between the TD50 and the ED50. So the therapeutic index, the TI, equals the TD50 divided by the ED50. We mentioned that the ED50 is the dose that achieve 50% of the effect. The TD50, on the other hand, it is the dose that achieve toxicity, harmful effect in 50% of the population. So it is the dose that achieve 50% of the harmful effect or the toxic effect. Example, if the toxic dose is 10 times the therapeutic dose, the therapeutic index is 10. So the TI, the therapeutic index, equals the toxic dose divided by the therapeutic dose. If the toxic dose is 10 and the therapeutic dose is 1, the therapeutic index in this case is 10. So the therapeutic index is a measure of the safety of drugs. For example, if let's say a drug that is the therapeutic index is 10, this means if you reach the 10 times the therapeutic dose, you would reach toxicity. So if you hear the therapeutic index for that drug is 10, you don't reach the 10th dose. You try not to, so you don't reach toxicity. So it is a measure for the safety of drugs. High therapeutic index means there is large difference between the dose of a drug that produces the desired effect and the dose that produces the toxic effect, and vice versa. So if a drug that has a high therapeutic index, this means that this drug is safe. While if it has low therapeutic index, it means it is dangerous because we are going to reach the toxic dose, and there's the difference between the toxic dose and the therapeutic dose is small, so we can reach it in a little dose, and it is dangerous this way. So drugs with high TI are more safe for clinical use and vice versa. Example, it is the warfarin, has narrow TI and requires careful therapeutic monitoring so we don't reach toxicity. And some drugs are toxic drugs in any dose. An example for that is the cancer chemotherapeutic drugs. Now let's explain the therapeutic index on the dose response curve. So we have the vertical axis and we have the horizontal axis. The vertical is response and horizontal is the dose. So let's say we start giving a drug and we start getting a response from this dose, and it's like that. We reach here the 100% of the response. So here we have the efficacy or the drug response here. But if we keep increasing the dose, we here reach the toxicity, meaning we start having a toxic effect of the drug, and it would increase with increasing the dose more. So here we have the 50% of the response, and here is the ED50, which is the dose that achieve 50% of the effect, and here we have the TD50. So the dose that achieve 50% of the toxicity, and the difference, or if we divide the TD50 on the AD50, we'll get the therapeutic index, which is the TI, which is here. It would be the difference, or it would be dividing the TD50 on the AD50. And with that, we reach the end of this video. Thank you guys for watching. Make sure to like and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this page. And with that, thank you for watching and see you soon. Peace.